Crohn's disease is a chronic inflammatory bowel disease that affects the digestive tract. It can cause inflammation in any part of the digestive tract, from the mouth to the anus, but it most commonly affects the small intestine and colon. The exact cause of Crohn's disease is unknown, but it is believed to be caused by a combination of genetic, environmental, and immune system factors. Symptoms of Crohn's disease can vary from person to person, but common symptoms include abdominal pain, diarrhea, fatigue, weight loss, and rectal bleeding. These symptoms can range from mild to severe and can come and go over time. Diagnosis of Crohn's disease involves a combination of medical history, physical examination, and diagnostic tests such as blood tests, stool tests, imaging tests, and endoscopic procedures. Treatment for Crohn's disease depends on the severity of the disease and may include medications such as anti-inflammatory drugs, immunosuppressants, and biologic therapies. In some cases, surgery may be necessary to remove damaged portions of the digestive tract. Living with Crohn's disease can be challenging, but there are ways to manage the disease and improve quality of life. This may include making dietary changes, managing stress, getting regular exercise, and working closely with healthcare providers to develop a personalized treatment plan. Overall, Crohn's disease is a complex and chronic condition that requires ongoing care and management. With the right treatment and support, people with Crohn's disease can lead full and active lives. Crohn's disease is a chronic inflammatory bowel disease that affects the gastrointestinal tract. The exact cause of Crohn's disease is not fully understood, but it is believed to be a combination of genetic, environmental, and immunological factors. Genetic factors play a significant role in the development of Crohn's disease. Studies have shown that individuals with a family history of the disease are more likely to develop it themselves. Researchers have identified several genes that may be associated with the development of Crohn's disease, including NOD2, ATG16L1, and Illinois 23R. Environmental factors may also contribute to the development of Crohn's disease. Smoking, for example, has been shown to increase the risk of developing the disease. Other environmental factors, such as diet and exposure to certain bacteria or viruses, may also play a role. Immunological factors are also believed to be involved in the development of Crohn's disease. The immune system normally protects the body from harmful bacteria and viruses, but in individuals with Crohn's disease, the immune system mistakenly attacks the lining of the digestive tract. This causes inflammation and damage to the tissue, leading to the symptoms of the disease. In addition to these factors, researchers are also investigating the role of the microbiome in the development of Crohn's disease. The microbiome refers to the collection of microorganisms that live in the gut. Studies have shown that individuals with Crohn's disease have a different microbiome than those without the disease, and that changes in the microbiome may contribute to the development of the disease. Overall, the cause of Crohn's disease is complex and multifactorial, involving genetic, environmental, immunological, and microbiological factors. Further research is needed to fully understand the mechanisms underlying the development of the disease and to develop effective treatments. 1. Salmon. Salmon is an excellent source of omega-3 fatty acids, which have anti-inflammatory properties that can help reduce inflammation in the digestive tract. Additionally, salmon is a good source of protein, which is essential for building and repairing tissues in the body. 2. Leafy greens. Leafy greens like spinach, kale, and collard greens are rich in vitamins, minerals, and antioxidants that can help reduce inflammation and promote healing in the digestive tract. They are also high in fiber, which can help regulate bowel movements and improve overall digestive health. 3. Bone broth. Bone broth is rich in collagen, which can help repair the lining of the digestive tract and reduce inflammation. It is also high in protein and other nutrients that can support overall health and well-being. 4. Turmeric. Turmeric contains curcumin, a powerful anti-inflammatory compound that can help reduce inflammation in the digestive tract. It has also been shown to have antioxidant properties, which can help protect the body against damage from free radicals. 5. Blueberries. Blueberries are rich in antioxidants and other nutrients that can help reduce inflammation and promote healing in the digestive tract. They are also high in fiber, which can help regulate bowel movements and improve overall digestive health. 1. Dairy products. Dairy products can be difficult to digest for people with Crohn's disease due to the lactose content. This can lead to bloating, gas, and diarrhea. It is important to limit or avoid dairy products to prevent these symptoms. 2. Fried foods. Fried foods are high in fat and can be difficult to digest for people with Crohn's disease. This can lead to inflammation in the digestive tract and worsen symptoms. It is important to limit or avoid fried foods to prevent flare-ups. 3. Spicy foods. Spicy foods can irritate the digestive tract and cause inflammation in people with Crohn's disease. This can lead to abdominal pain, diarrhea, and other symptoms. It is important to limit or avoid spicy foods to prevent flare-ups. 4. High-fiber foods. High-fiber foods can be difficult to digest for people with Crohn's disease, especially during flare-ups. This can lead to abdominal pain, bloating, and diarrhea. It is important to limit or avoid high-fiber foods during flare-ups to prevent worsening of symptoms. 5. Alcohol. Alcohol can irritate the digestive tract and cause inflammation in people with Crohn's disease. This can lead to abdominal pain, diarrhea, and other symptoms. It is important to limit or avoid alcohol to prevent flare-ups. Crohn's disease is a chronic inflammatory bowel disease that affects the digestive tract. While the exact cause of Crohn's disease is unknown, there are several factors that can increase the risk of developing the condition. However, there are also several ways to prevent Crohn's disease. Here are some tips to help you reduce your risk of developing Crohn's disease. 1. Maintain a healthy diet. Eating a healthy, balanced diet can help prevent Crohn's disease. Avoid processed foods, sugary drinks, and foods high in saturated fats. Instead, eat plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. 2. Exercise regularly. Regular exercise can help reduce inflammation in the body and improve overall health. Aim for at least 30 minutes of moderate exercise, such as brisk walking or cycling, most days of the week. 3. Quit smoking. Smoking is a major risk factor for Crohn's disease. If you smoke, quitting can help reduce your risk of developing the condition. 4. Manage stress. Stress can trigger symptoms of Crohn's disease, so it's important to find ways to manage stress. Try relaxation techniques such as deep breathing, meditation, or yoga. 5. Get enough sleep. Lack of sleep can weaken the immune system and increase inflammation in the body. Aim for 7 to 8 hours of sleep each night to help prevent Crohn's disease. 6. Practice good hygiene. Wash your hands regularly to prevent the spread of bacteria and viruses that can cause infections that may trigger Crohn's disease. 7. Consider genetic testing. If you have a family history of Crohn's disease, consider genetic testing to determine your risk of developing the condition. This can help you take steps to prevent or manage the disease. By following these tips, you can reduce your risk of developing Crohn's disease and improve your overall health. Crohn's disease is a chronic inflammatory bowel disease that affects the digestive tract. It can cause a range of symptoms, including abdominal pain, diarrhea, fatigue, and weight loss. While there is no known cure for Crohn's disease, there are several ways to manage the condition and improve quality of life. One of the most effective ways to manage Crohn's disease is through medication. There are several types of medication that can be used to reduce inflammation and relieve symptoms. These include anti-inflammatory drugs, immunosuppressants, and biologics. Anti-inflammatory drugs such as corticosteroids can help reduce inflammation in the digestive tract, while immunosuppressants can help prevent the immune system from attacking the digestive tract. Biologics are a newer type of medication that target specific proteins involved in inflammation. In addition to medication, dietary changes can also be helpful in managing Crohn's disease. Some people with Crohn's disease find that certain foods can trigger symptoms, such as spicy or high-fiber foods. Keeping a food diary can help identify trigger foods, and working with a registered dietitian can help develop a personalized diet plan that meets nutritional needs while minimizing symptoms. Stress management techniques can also be helpful in managing Crohn's disease. Stress can exacerbate symptoms, so finding ways to reduce stress can help improve quality of life. Techniques such as meditation, deep breathing, and yoga can be effective in reducing stress. In some cases, surgery may be necessary to manage Crohn's disease. Surgery may be recommended if medication and lifestyle changes are not effective in controlling symptoms or if there are complications such as bowel obstruction or abscesses. Overall, managing Crohn's disease requires a comprehensive approach that includes medication, dietary changes, stress management, and possibly surgery. Working with a healthcare team that includes a gastroenterologist, registered dietitian, and mental health professional can help develop a personalized treatment plan that meets individual needs. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.